Hello, my name is Dr.陳政汶, and I'm a Hong Kong registered chiropractor. Today, I would like to talk to you about pelvic tilts and an exercise to help get the pelvis moving. So without further ado, let's begin. So we'll first talk about anterior pelvic tilt, which is when the pelvis arches forward like this, causing the butt to protrude backwards, as well as cause an overarched lower back. There is also a posterior pelvic tilt, where the reverse occurs and the butt appears to go forward and your abdominals protrude forward a little as well. These pelvic tilts are actually just the normal movements of the pelvis, and if you find yourself to be stuck in a certain posture in one of them, it could just mean that you need to move your pelvis a little more. There are two main types of pelvic tilt. One is the anterior pelvic tilt and the other is the posterior pelvic tilt, which I will demonstrate to you. So from the side view, an anterior pelvic tilt would likely look like this. Just imagine the pelvis this way, it's going forward. So what you get is this exaggerated buttock protruding outwards. Okay, the second one would be the posterior pelvic tilt, where the pelvis, it starts to move backwards like this. So you get this forward sway posture. If we do not use the pelvic tilts enough, then it's going to cause us problems. I'm just going to show you what happens if you use your pelvic tilts well, especially when you're performing a squat to pick something up from the ground. When we're doing squats, we must move our pelvis into a bit of an anterior pelvic tilt. Now, bring the pelvis into forward rotation like this. At the same time, bring your lower back into flexion, keeping the spine straight at all times. And then now you can just push all the force going downwards to the buttocks and make a squat, pick up whatever you need, and come back up using your quads back to normal posture. Compare this to someone who does not know how to use their pelvis or does not know how to tilt their pelvis. They will most likely do something like this. So this would bend our back and make it more prone to injury if done repeatedly or with higher load. To enable you to better visualize the exercise you're going to perform later, I'm going to show you over here using this model of the spine how we're going to perform the forward and the backward rotation of our pelvis. So if you look here, this would be an example of someone just lying down normally on a surface. Okay, so when we're going to perform the forward rotation of the pelvis, you have to look at this part of the pelvis. When I say it goes forward, it actually rotates this way. So when it rotates this way, what you can immediately see is that there's an increase of the curve of the lumbar spine over here. And this would feel like the lower back is moving upwards away from the surface. Okay. Now, to move the pelvis backwards, we're going to see this part going the other way like this. So when you do this action, the lower back would be brought in contact with the surface like this. To perform the supine pelvic tilt exercise, first of all, you need to find yourself a suitable, comfortable place to lie down on, such as an exercise mat or even a firm bed like this. Next, you want to bring both of your knees up, okay, keeping them together. But if you can't keep them together, it's fine as well. So bring them together like this at around a 90-degree angle. Now, we're going to go through the forward and the backward movement of the pelvis as described before. And we're going to incorporate a bit of a breathing exercise into it as well. So please do breathe using your abdomen. So to demonstrate, I'm just going to show you once. When we inhale, the belly should fill up like this. And when you exhale, it should flatten like this. Okay? To start with, I'm going to move forward. So the direction is moving like this. And I would like you to take a deep breath in. Contract your lower back muscles, as well as the front thigh muscles, and move your pelvis like this. Okay? You should feel the lower back leaving the surface, moving upwards. Hold this position. Okay, so you were inhaling just now, so now exhale and breathe in again and breathe out. Breathe in and breathe out. When you're ready to move on to the next position, I want you to again breathe in, and as you breathe out, move your pelvis into this position. So as you were breathing out, you should feel the abdominals contract, as well as the contraction of the gluteal muscles, like this. As you feel your lower back touching the surface again. So we're going to keep this position right now and breathe in, breathe out. Breathe in, breathe out. One more time, breathe in and breathe out. And relax. Okay, exercise. However, please always consult a healthcare professional if you have any doubts or queries about your pain and symptoms. Please do like and share the video. To learn more about chiropractic and physiotherapy, be sure to subscribe to our channel for more updates and leave a comment below. Take care, and I'll see you in the next video. Bye bye.